Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners and create custom medications to help our patients get better. So in this episode, our guest is Dr. Sheri Salartash from the Dynamic Dental Wellness in Ashburn, Virginia. Dr. Salartash is a returning guest, and in this episode, we're going to discuss how biological dentistry can help sleep apnea. So before we begin, welcome, Dr. Salartash, and could you please introduce yourself to the listeners and viewers?
Yes. Good morning. I'm Sheri Salartash. I'm a biologic dentist in Ashburn, Virginia, and it's an honor to be on the podcast today to talk about what patients can do and look for to help their loved ones and the kids and everybody around them to have a better quality life and just, be healthier.
Gotcha. So a disclaimer before we get started. The information discussed today is for information purposes only, not for diagnosis or treatment. So before we jump into it, could you just kind of explain the difference between, a holistic dentist versus like a conventional dentist that I kind of go to every 6 months for cleaning? Could you tell us a little what the difference is?
Sure. To kind of keep it short and sweet, because there's a lot of different. So in biologic dentistry, we focus on whole body health, and we take a very detailed history of the patient and then listen to their concerns and specific symptoms and try to connect the dots, try to be the detective for them and seeing what has possibly contributed to different conditions in their body. We stay away from toxic chemicals and materials such as heavy metals, mercuries, nickels, metal crowns, metal implants, and we do not agree with use of fluoride, as well as BPA, BisGMA, bisphenol. A lot of resin composites have those in them. And over time, even just little exposure every day, they are like these materials are embedded in our mouth forever. So little exposure every day will cause issues. So we want to kind of reduce the burden on our system and also immune system with avoiding root canals and having technology and equipment in our office that would help us reduce chance of root canal by 90%, such as the lasers and the ozone treatments and biomimetic works. So those are all the differences.
So our first podcast was about such things that you talked about, heavy metals and what to stay away from. So those that are interested can listen to our first podcast. So today, sleep apnea. Basically what I know as sleep apnea is like an airway obstruction. You kind of at night, you actually stop breathing, at different times during the night. Could you talk to us about like what is sleep apnea and, what is happening at night when we're sleeping?
Sure. So interestingly, 80% of patients that have sleep apnea will never find out they had sleep apnea. So it's a silent problem, and it can be in kids, it can be in adults. So we see a lot of kids in our office, and we assess. We do a different assessment, airway assessment, as part of the initial examination when adults or kids come in to see the position of their tongue, the size of the tongue, the size of the airway, their breathing patterns, and kind of be the detective to pick out the possible signs of sleep apnea. Patients that have sleep apnea, we see a lot of wear on their teeth. We see recession around their gums. We see these people having multiple root canals, fractured teeth, because they're taking the forces, or basically they're trying to open up their airway when it gets collapsed overnight, and they start clenching and grinding to move that lower jaw forward to get the tongue out of the airway. During a sleep apnea event, or upper airway resistant event, which is like a precursor to sleep apnea, it happens before, and it's where the tongue clogs up the airway, and then there is a few seconds of stop breathing, and it can be apnea or hypapnea events. And then when the patients do it, in order to confirm does someone have sleep apnea or not, they need to do a sleep study to have all the numbers read by a sleep physician. And they can either take a home sleep test, or they can go sleep at a center where the technician is watching them and everything is getting recorded. A lot of people feel better when they do the home sleep test, and these home sleep tests, they all go to the sleep physician. They will read by them. So, and yes.
Oh, no. So I was going to, ask you, is that something that you order, or it has to be done, like for the diagnosis of sleep apnea? A sleep study has to be done, or can you do that diagnosis just with what you were talking about, the grinding of the teeth that you notice?
Sure. So those are all the signs of possible upper airway resistance or sleep apnea. We cannot diagnose off of just signs we see in the mouth. So if we see those, we give information to the patient and ask them to do a sleep study, so we can have a final confirmation that yes, there is apnea, or no, there is no apnea.
Now I'm curious, is snoring a sign of sleep apnea, or is it different?
Yes, it could be. Snoring is when the soft tissue is vibrating in the back of the airway, but a lot of people that have sleep apnea, they do snore as well. A lot of people that have TMJ, jaw joint issues, they have sleep apnea. So there are things that go hand in hand. So to answer your question, if somebody's sleeping, if somebody is snoring, it is a good idea to get a sleep study done to confirm if there is any problems. I'm a proactive person. I don't like to wait till problems and conditions get to a level that you can't do much about.
Yeah.
If something is there, we want to catch it early and reverse it.
So, can you talk to us about what are some downstream effects that take place in our bodies when we don't resolve this situation? Like you said, you are proactive. You like to get to an early diagnosis of it. So what if a person does not resolve the sleep apnea or does not know about it, what are some downstream effects do you see that are, that happens to our bodies?
Sure. So when usually the sleep study is done, one of the things that are measured is the oxygen saturation level. One thing in life that we cannot live without is oxygen. So imagine if every night for 10, 20 years, our oxygen, instead of being above 96, drops to below 90, 80, 70%. So we are taking away those percentages from all the organs and systems in our body. So everything will suffer to some extent. And then if we have an area in our body that is weaker than the rest, that organ will suffer the most. Because when we are sick, what do they tell us? They say, go take a rest, go sleep. Because during sleep, we expect everything to repair. There should be good oxygenation and growth hormone, growth factors getting released and things getting repaired. But if we don't have that good airway and the oxygen saturation drops, then there would be big issues coming up. I actually lost my dad to sleep apnea. So that's why I say that we got to be proactive about problems. And this is many years ago. And I wasn't a dentist. I didn't know the things that I know today, but yeah. So that's kind of like that kind of becomes more on a personal level, but
Yeah.
I don't like to see my patients in that situation. And that's why anything comes up, I'm like right on it and want to get it resolved.
So, let's talk about corrective therapy. What do you use in your practice with patients with sleep apnea?
Yes. So the first line is measure to find out where's the sleep apnea coming from. Is this a nasal obstruction? Is this upper airway obstruction? Or is this a central apnea? So those are all like different things. If it's a central apnea, they have to work with a physician and get that resolved. Central apnea is where they just stop breathing because of the neurological issues. Like their body
Okay.
doesn't send a signal for them to keep breathing. So that's a big issue that needs to be
Yeah.
seriously looked at. Then there is nasal obstruction, and then obstruction at the um, behind the tongue level and upper airway. So if they're depending, we look. I mean, I can share the screen with you, so it kind of
Sure.
makes more sense. So I will show you this.
And to our listeners, I'll make sure that we attach these slides to the show notes.
So over here, I'm just gonna make it larger so you can
Okay.
see better.
Yep.
Okay. So sorry, let me go back. So usually what we do is we take a full records and analysis to see the measurement of their arches, how wide their palate is, the position of the upper jaw compared to the lower jaw, to the base of skull, to the TMJ, and to their airway. And then according to what we see on the cone beam scan, on the three-dimensional scan, we can pick up also from the sleep study and the cone beam scan if they have nasal obstruction, which that needs to be worked on with an ENT. If their problem is coming from the tongue position and the upper airway, then what we work with the patient is repositioning their jaw. Kind of, you see right here how far this patient is as far as the
Yeah.
jaw position, and after treatment, the jaw has translated forward. This is their palate. Before treatment, the palate is very narrow. This is not enough room for the tongue to rest. So in that case, the tongue will collapse into the airway. Like here, this is the patient tongue. Tongue is in the airway. Once the treatment is done and the arches are wider and the arch has expanded and the jaw has translated forward in 3 dimensions, then the tongue will have more room to sit forward. So the airway would be wider. So for all of our patients that go through the record step, we measure their airway in the cone beam scan to see what it looks like structurally, as far as if they have enough room for the air to kind of pass through.
Now, how do you, you said you repositioned the jaw. Is that
Yes.
where, I've read where you use appliances, and if you could talk to us, like, when I read appliances, I really don't think about, in your terminology, it's almost like a brace or that it looks like, but if you could talk to us a little bit about appliances or the types of appliances.
Sure. Yes, and I will show you quickly what appliances, a sample of, like an example of a patient that had appliance in their mouth, if I can find that slide really quick. So this is actually a child patient here. So I like to use minimally invasive appliances where they don't take much room. Because if a patient doesn't have enough room in their mouth, then there is no point of putting a bulky appliance in there. That's just going to make things worse. We want to use something that is gentle, that can help expand the palate. So as you can see right here, this is a advanced light wire functional, which works very well with the body, and it helps us as we adjust the loops, we can expand that arch. There are other appliances that can be used. This is one of the ones that I like the most, but there are other expansion appliances that could be specifically made for the patient, custom made by the lab. We write the order to the lab according to the numbers we get from their measurements, and then we send the order to the lab. We get the appliance, we install it and adjust it every month for the patient till we get to the final result of full expansion, full arch form, where it's supporting their tongue position and also their airway and their TMJ.
So Dr. Salartash, I got a dumb question to ask you. How does a kid tell someone that, like there's no way to find out they're having sleep apnea? How does a growing kid with a palate that's also growing, like how do you suspect or how do you know? Like, how do they come to you?
So there are signs and symptoms. Actually, luckily, the parents these days are very educated, and they either read or they do their research because they see different signs in their kids where they are mouth breathing, where they have dark circles around their eyes, when they are tired during the day, where they have maybe some people complain of like silent reflux where they see like erosion on the teeth. Some of the parents we see, they are very well educated, so they come in and they know the signs. When we have patients coming in that are families and have kids, I usually give them a book that we wrote, the children sleep related.
Okay.
Disorder breathing. So those signs and symptoms are mentioned in the book. One of the early signs are like when they are older and they actually are able to like control a lot of stuff. So I have this page here which goes over like different signs and symptoms of the things that to look for to be a detective of what's going on with my child. Why does he have aggressive behavior, restless leg, allergies, nightmares, teeth grinding, anxiety attacks, frequently ill, not growing like the rest of the kids, like shorter in weight, or they're overweight or obese. They have maybe ADHD patients, a lot of kids that have sleep apnea, they get labeled with ADHD, ADD. That's not their real diagnosis. The real diagnosis, they need to look deeper and look at, does this child have sleep apnea? How are they doing overnight? Are they going to REM sleep? Do they have the deep sleep? Is the brain detoxing at nights during that deep and REM sleep? So,
most kids growing up, we always take them to the orthodontic to get some, braces put on or Invisalign. Do they help with sleep apnea, or is that where could an orthodontic refer a child to you just because they may also suspect like the palate is not growing properly or may have sleep apnea signs and symptoms?
In what I have seen, the orthodontics is wonderful and great, but only if we do our assessment of the jaw position and jaw width to first correct that. So before we make the patient smile looking nice, we want to make sure the bones are in the correct position and they are wide enough. So basically putting the carts, fixing the railroad and then putting the carts on the railroad.
Okay.
So a cosmetically nice looking smile, but orthodontics and braces and aligners, Invisalign is wonderful and great, but that should be phase 2 treatment. Phase 1 should be always focusing on skeletal positioning, making sure airway and jaw joint and all that is looked at and taken care of.
So, at least when I was prepping for this episode, you hear the term sleep apnea, think about those little masks, that you put around the CPAP machine mask. Do you use those in your practice at all, or are they helpful? I mean, obviously they're helpful. They're putting oxygen in your blood, at
Sure.
night.
Sure. So whenever patients have like their test results come back as severe sleep apnea, they have to start with the CPAP. They do need a
Okay.
CPAP. And what CPAP does is forces air down past the blocked tongue. If they are on a machine, a CPAP machine that is connected to the oxygen, that's when they get also oxygen delivery. But we one thing that I observed with my dad is you do not want to do what was naturally intended for the body to do itself. Yes, at some point we need some help, but you do not want to be bound to an appliance or a nighttime wearing of the CPAP. If you are able to grow out of it, if you are able to correct it, that would be the best option. So,
Okay.
and by jaw expansion, that would be helpful to get the tongue in the correct position, making sure the nasal passages are clear, making sure patient doesn't have any sort of allergies, being food sensitivity or environmental allergies that is causing nasal blockage where they have to mouth breathe, and just that would not be a good situation. So I'm just gonna share again this slide with you, uh, going back to the appliances. Uh, when we are able to expand the palate from being narrow to wide, we are also increasing the airway size. So the airway goes from this size to like 3 times bigger, 2 times bigger, which would be the goal. One other area that we usually look at is the soft palate here. I'll show you here with the nightly. So there is also an adjunct treatment to the appliance therapy, uh, working on the tongue. Sometimes patients have tongue ties. Tongue ties also contribute to sleep apnea, meaning that the tissue that attaches the tongue to the floor of the mouth is very tight. So it doesn't let the tongue move freely and be against the palate, because the tongue home office is against the palate. It needs to be up and forward. If it's leashed down and back, then it's going to clog up the airway. So doing myofunctional treatments, tongue exercises. Tongue is one of the strongest muscle in the body. So if we, just like we want to build our biceps, if we want to make our tongue more stronger, then what we do is do exercises, tongue exercises, which are called myofunctional therapies, and just lifting up the tongue, rolling it around, or working, or if that's too hard for the patient, working with a therapist that could guide them into gaining full tongue function. If their tongue ties are severe, then they need to be released, and we help the patient with tongue tie releases if they have a tongue tie, to allow the tongue to move easier. And that tongue tie release is done with the laser, and it's beneficial to the patient. One other treatment that we do in the office is also called night laze, which is done with the laser treatment. We are not removing anything or cutting anything. With the night laze, what we do is we activate collagen formation in the soft palate area that will help firm up and lift up this tissue, this is what you see. And we can see more of the airway, and the tissue is less saggy, and it's not going to clog up the airway as much.
Okay. So, outside of these therapies, do you recommend any lifestyle or nutritional therapies with
Yes,
this? Do they play a role at all?
definitely. So one other thing is looking at the BMI. BMI is important in patients with sleep apnea. If they're able to balance that and also balance their blood sugar levels. That is huge help with the sleep-related issues, as well as exercise have a big factor. So, I mean, exercise is good for almost anything, and as well as sleep apnea, to kind of work on the oxygen saturation levels and all that. And then usually when we take a heart rate variability on all of our patients when they initially come in. So once they are done with treatment, we see huge improvement in heart rate variability and their autonomic nervous system when they have followed the treatment protocol. As far as we give them, when they are going through appliance therapy, they have to be on a good, healthy, nutritional regimen, whereas they are getting enough vitamins and minerals so their body is able to lay more bone in the areas that are needed for expansion. And that not only helps with expansion, it helps all their organs and cells and functions, cellular functions.
So, Dr. Salartash, before we end, could you share with us or recommend to kids and parents and adults, what is that one thing that you would highly recommend about sleep apnea, what to do? What will be your last comment on this?
Sure. So just especially when we have younger kids in our house, just watch them, look at the way they're breathing, make sure they're not mouth breathing. If they're mouth breathing, then look at what's causing their mouth breathing. If they have allergies, food allergies, or enlarged tonsils, or their nasal passages are blocked, try to nip those problems straight up right at the beginning. Don't let it go, and don't ignore the little signs that we see. Just even if you can do a smallest thing and close that lip for the infant. You see sometimes infants are mouth breathing. Just put the lips together, as a reminder, hey, I did that to my daughter. And just like everybody else, like my nieces, nephews, I go around and I look at the kids and I'm like closing their mouth. I'm like, just breathe through your nose,
I remember my parents doing that.
Yeah. And breathing exercises. I mean, they teach us everything at school. One thing that I guess either at school or at home, the parents need to look into is doing some breathing exercises, reminding ourselves how God intended us to use different systems in our body. That there was a reason we have a nose to breathe in, right? Not the mouth that's breathing. So that would be one thing that they can work on at home and kind of get it corrected, and also looking into any sort of inflammation problems that could cause blockage in the nasal passages.
Well, Dr. Salartash, thank you for sharing all this good information with us. Thank you for joining us today again. And how would someone reach out to you? And we'll make sure we'll get some of these slides in the show notes. But how could someone reach out to you?
Sure. They can always call the office at 703-775-0002. And I'm sharing the slides so you can see it here. And they can also email us or go on our website, Dynamic Dental Wellness, and send us a message. And we are always here to answer questions.
Well, thank you once again. And I'll make sure to put all the stuff in the contact on the show notes. And sure. I want to thank everyone for tuning into the Compounding Center Connections podcast. We hope you found the information presented today to be helpful. If you have any questions or comments, please feel free to reach out to me at j@compoundingcenter.com. Subscribe to our YouTube channel and our podcast channel, The Compounding Center Connections, and stay tuned for future episodes. Thank you, Dr. Salartash.
Thank you. Appreciate it, Jay. Have a great day.
You too. Bye.
Bye.